Welcome to the Unlock Wellness Podcast. I'm Dr. Casey, and today's guest is Dr. Gillian Sawyer. And Dr. Gillian is a chiropractor who has a main focus on women and pregnancies and babies. And for the pregnant women and postpartum, specializing especially on the pelvic floor strengthening pre and post pregnancy. And she's certified through ICPA. I'm also certified in the Webster Technique. And she really puts a lot of amazing content out there, and I love the work that she's doing. She's really helping a lot of people. So thank you so much, Dr. Gillian, for coming on. I really appreciate it.
Thanks so much for having me.
Awesome. So, Dr. Gillian, why don't you get started with talking about your backstory a little bit so people get to know you a little more, how you got into chiropractic and on the path that you are on right now.
Yeah. I started seeing a chiro myself when I was in elementary school, actually. I had a high jumping accident at track and field day when I was little and had some injury from that I definitely needed care for. And chiropractic was one of the only things that helped me with pain at that point. So it kind of got me down the road of looking more into what chiropractic was all about. And that's what led me to go to chiropractic school, actually.
That's cool. That's cool. And I mean, it's not fun to have an injury, but that's cool that that happened so that you were able to start getting adjusted at an early age, because most people don't get that.
Yeah, totally. I think people end up coming in because of some type of injury, and then their care kind of moves from there, right?
Right. Yeah. So that led you to chiropractic school, and then how did you transition to working mainly with pregnancies and babies and kids, or was that something that you kind of knew that you were interested in early on?
I've always had an interest in women's health. When I was in chiropractic school, I did lots of additional training with the ICPA, which is the International Chiropractic Pediatric Association. And they train us how to take care of mamas when they're pregnant and babies. And I just continued with ongoing training in that area. And then really the interest or the passion peaked for me when I became a mom myself. So my oldest is 3.5 years old and my little one is almost a year.
They're both adorable, by the way. I've seen their pictures on Instagram. They're so cute.
That's awesome. Yeah, they keep me pretty busy, and just going through those changes in my own body with being pregnant, and then going into postpartum and having things come up in my pelvic floor, and all the thhave come with motherhood has really honed in my passion with working with moms through pregnancy and postpartum.
Yeah, I mean, I think I have a 1.5-year-old. I think once you go through that experience, you gain a whole nother level of respect for how smart our bodies are and what a woman has to go through during that process, because it's so much. I mean, during that 9 months and even afterwards.
Oh, absolutely. It's such a short amount of time for all the changes that take place.
Right.
It's just wild.
It is. And I love that you've done a lot with ICPA. I actually, a few weeks ago, I did the pediatric adjusting and cranial. It was awesome with Dr. Rosen. Is that who you had too?
Yeah, absolutely.
Yeah, he's so great.
He's so great.
Yeah. But, I know that you were talking about earlier, you do a lot with pelvic floor health. And I know that it's, for a lot of doctors, that's not really a large focus. But I think that we understand that it should be more of a larger focus for women, especially during pregnancy and afterwards. So, how did you get into that and as a focus for your patients?
Yeah. So I had my first baby. It was a really quick delivery, and I had a prolapse as a result. Mm-hmm. And it wasn't until 8 months postpartum after my first that I started to think okay, I don't think this is normal. I don't think my body should still be feeling this way. And so at that point, I went and sought out help from a pelvic floor physio. And that totally changed my perspective on the importance of that with postpartum. And so much of that can be kind of prevented or helped even while pregnant. So that was a game changer for me. Until I felt it in my own body, I didn't really understand how important that can be.
Right. Is there a network of physical therapists that deal with those type of issues? Is there a network that people can go to for recommendations? Because I know that it is a very specialized field, and you don't know who to trust sometimes. So I didn't know if you had recommendations all over for that kind of
You
thing?
know what? That's a good question. Like, if you were to be searching for someone in your area, you would look for a pelvic health physio or a pelvic floor physio. And I don't know whether there's an association that actually houses information with all of the people that are trained in that area, but they have additional training as physiotherapists for pelvic floor health specifically.
That's cool.
So,
Yeah.
yeah.
Because I know, I mean, it's so specific and it really does take, specialized training to understand all of that because it is a lot. I mean, it's very detailed.
Absolutely.
Yeah. And what are some of the things that I know that you put out a lot of content on Instagram and it's awesome. Some of the things that you would recommend to women if they are pregnant or maybe if they've just had a baby, like what kind of things should they be doing to really just reinforce their pelvic floor health or just their strength overall? We're chiropractors, so spinal health as well. Like what are some of the recommendations that you're, giving new moms or pregnant women?
Yeah. So, one of the things that I do, just because the pelvic stuff in general is a little bit out of our scope of practice. So when I care for women when they're pregnant and postpartum, I always encourage them to go seek out a pelvic floor physio to have that internal assessment, because it really gives us a better idea as to whether or not their strength is good, whether there's imbalance from side to side in the pelvic floor, whether or not there's any dysfunction or like incontinence or prolapse or things like that going on, because that can really affect their outcomes with what we're doing as well, right?
Right.
So one of the things that's in our scope that I really focus on with women, to be honest, is the alignment. Because if you look at how our bodies are situated with pregnancy and the changes that take place in terms of like our center of gravity and how everything's sitting, specifically with our rib cage and our pelvis and how they are oriented over one another, those the cues that you can give women while pregnant or postpartum on how to be conscious of their alignment can really affect how their core is functioning. And we know that the pelvic floor is part of the core. So if you can get the alignment at a elementary level in a nice position, you're really going to affect the function of the core and the pelvic floor. So that's where I would focus and practice on.
Absolutely. And I'm sure there's, countless amount of things that you can do to help. Because if somebody has a desk job and they're
Yeah,
sitting in an awful alignment for 12 hours and they're pregnant, I can't imagine the effects that they're having and the pressures that they're putting on the
absolutely.
pelvic floor. Yeah, definitely.
Yes.
I know you were talking about with the alignment and with the rib cage. Did you want to go into a little bit about how like the relationship between like breathing exercises and pelvic floor health? Because most don't
Yeah.
really correlate the two, but they are heavily dependent on one another.
Yeah, absolutely. So I guess without a visual, I'll explain in the air with my hands. um, if you think about the core as a canister, so the top of your core being your diaphragm underneath your rib cage, the bottom of your core being your pelvic floor muscles, the front being those deep abdominal muscles, and then the back being those little stabilizing muscles that we have in the spine. All of those things all together form a canister, which essentially is your core. So when you're looking at the movement in any one of those pieces or the alignment of any of those pieces, it's going to affect the function of all the other things. So when you talk about breathing, the way your diaphragm's actually moving is going to affect how much pressure is being put on your pelvic floor. So you could cue women to help to relearn that really nice diaphragmatic breath where your ribs are expanding out to the side instead of bringing, let's say, air into your belly, which is going to cause a lot of additional pressure on your pelvic floor. In terms of alignment, having that canister really look like a canister. So having your rib cage stacked right over top of your pelvis so that your diaphragm and your pelvic floor are situated right over top of each other would be really helpful in terms of the decreasing the load on the pelvic floor with pregnancy or postpartum.
Yeah, that's awesome. And if anybody does want to see this visually, at the end I'll have her talk about different ways you can follow her like on social media. I know that she's put out a lot of content on Instagram explaining that, and like she
Yeah.
said, she probably has a lot where she is explaining it visually. So if you are a visual person and want to see it, she has a lot of amazing videos that will show that. And because I think the problem is a lot of exercises and different positionings, they are increasing the pressure more than they should be, whereas a lot of these breathing exercises are decreasing the pressure, right?
Yeah,
Yeah.
absolutely.
And are there certain things that that people, that pregnant women or postpartum women are doing that are recommended that you're just like, they really need to avoid that. You know what I mean?
Yeah, I feel like with pregnancy and postpartum, if you can just generally try to decrease the inter-abdominal pressure. So, for instance, if you were to do like a crunch with pregnancy or postpartum, you're going
Mm-hmm.
to cause so much pressure inside the abdominal cavity. And that pressure is just going to go downwards into your pelvic floor when it's trying to heal and trying to support a baby if you're pregnant. So, things like that. Sometimes even planking is hard if you have a lot of load in the abdominal cavity that your pelvic floor can't really take on that load as much when it's under all the other stresses. The other thing too is talking about Kegels. Having that really intense strength in the pelvic floor is not so beneficial. A lot of pelvic floor physios now would argue that people's pelvic floor dysfunction maybe is coming from too much strength or too much hypertonicity, and the pelvic floor can't actually function well because it's holding too much tension. So it's not all about that like hardcore strengthening. It's really about having things at a neutral length and actually be able to react to all the stresses and the movements and the positions that we're in from day to day.
Yeah, no, that's awesome. Because I mean, that is what is, preached a lot of the time are, to do Kegels or,
Yeah.
crunches are probably one of the first exercises most women do when they start working out again post-pregnancy because they want to get rid of that, they want to get back to their pre-pregnancy weight and it's too much.
Yeah. You know what a really good resource for mamas? She kind of Katie Bowman is
Okay.
a amazing resource. She's got a website that you can Google. She talked a lot years ago about Kegels and how they weren't that great for you.
Mm-hmm.
And all of her information is based on alignment. And there's so many things that we can apply to the pregnant body and postpartum and integrate how the pelvic floor is connected to alignment. So she's a really great resource. Her name is Katie Bowman. She's out of the States.
Cool. Yeah. No, I'll put her in the show notes as well. That way people can go check her out as well. Were there any other resources while we're talking about that you recommend for people that are, trying to learn more about this topic in particular?
Yeah. On my website, I have a resource page and there's lots of links there under topics to different areas that might be helpful for mamas.
Awesome. Perfect. Yeah, so like we were talking about with, just trying not to overdo things physically afterwards. I know everybody is different. Have you found that there is a certain time where moms postpartum should be doing things physically? Because typically, they say 6 weeks, but, it takes almost 10 months to make a baby and for your body to change. It takes almost that time plus more to heal. We hear like 4th trimester all of the time. But I mean, it really is true. Your body has so much healing to do. Like I said, it was a year and a half ago for me, and I'm still feeling like I'm still getting back to normal, just feeling 100% back to myself physically. But do you think that there is a certain time frame that you recommend people to start doing certain things physically?
You know what? I think the biggest thing is to really listen to your body. If you go and do things that you were doing pre-pregnancy or even during pregnancy, and you finish whatever that is, and you're feeling heaviness in your pelvic floor, or you're experiencing incontinence, or you're having pain in your pelvis and the joints, pain in your lower back, those are just cues. Your body's telling you something like that is just maybe too much for you at that point in time. And I don't think there's a steadfast rule in terms of, 6 weeks, you're in the clear, like go and do that. That is something that irks me actually.
I know, me too. Because there's no way to know. It's almost like it reminds me of like somebody having like a specific due date. It just irritates me because you can't pick like the exact day a baby's going to be. Yeah, but totally. It's crazy to give somebody an exact date like that.
The other thing is, too, like if you're breastfeeding, like your hormonal changes and the amount of time, like you said, that takes to get back to normal is huge. I think that having your alignment checked by a chiro would be amazing postpartum. I always recommend mamas to try and get in within a month after they deliver because that's going to affect how all those joints feel for sure. And then having an assessment with a pelvic floor physio would be amazing if you could aim for that at 6 weeks postpartum to really get an idea of what you're dealing with. And then one of the things that I love to gear women towards is like restoring the core and the pelvic floor before you get back into all those exercises that you were used to. There's a mama that I work really closely with named Jessie Mundell. She's also on Instagram. She's a great resource. She has a program called Core and Floor Restore. That is something that I did postpartum after my second, and it was like really night and day how I recovered after the second compared to the first, actually.
That's cool. Yeah, I'll put her link in there as well.
For sure.
Awesome. Yeah, I mean, that has to be so important to do those kind of things first. I mean, I see way too many people jumping into like some really hardcore stuff right after pregnancy. And I mean, maybe their body can handle it, but I'm just thinking like you were saying, there's so many hormonal changes and so many, your ligaments are still getting back to normal, and you're just trying to get your hip stable as well. But yeah, I mean, there's so many changes going on.
Absolutely. Like, just be easy with yourself. There's no, like, it's not a race. Like you said, it took 9 months to grow your baby. So give yourself time to get back. There's always time.
There's always time. Absolutely. And then I know that you're working on, a lot of programs yourself for women and new moms. You want to go into talking about those a little bit?
Yeah. So right now, I'm in the final phases of a program called Your Body After Baby. And it is exactly this. It's all the things that we go through when we transition into motherhood. We're talking about mental health postpartum, your pelvic floor health postpartum, your hormones in that first year, your alignment, your breathing, and returning to exercise safely. I think that one of the things that's missed in postpartum care is you have your baby, you get sent home, and then that's it. Like, there's no guidance with regards to all of these things.
Right.
And your body and everything has gone through such a significant change that you really need the tools to sort through all these new things. Because for me, my body, my mental health, my pelvic floor, everything was very different than what I was used to pre-baby. So I have developed this program to give mamas some trusted resources to help to navigate that year postpartum, because I think it's so important.
It definitely is. And what's is that available through your website, or how would somebody get involved with the program?
Yeah, so it launches on June 27th. You can go, there is a link right at the top of my website to the waitlist of the program, and you'll get some sneak peek information and then a special discount for anyone who's on that waitlist. And so that is at gilliansawyer.com.
Awesome. And then does the actual program, is it just a combination of video coaching and blogs and different articles and resources, or how does that look like?
Yeah, so it's totally online. You'll get access to all these different sections of the content. I have expert interviews with pelvic floor physios, naturopathic doctors, fitness professionals, and mental health professionals to give people a better idea of what that all looks like postpartum, because again, it's a little bit out of my scope, but that information needs to be integrated. And then there's some articles that'll be linked. There's some downloadable stuff. And then if you are used to or loving my videos on Instagram, there will be a lot of video content from myself with regards to alignment and breathing and diastasis and all of these things. So yeah, something that you can work through on your own time in the middle of feeding your baby.
Yeah, you definitely during those, especially at the beginning when they're nursing, like 30 minutes on each side. You can sit and watch those videos. You were talking about diastasis. Can you hit on that a little bit? Like what you recommend when you see that type of situation? I mean, I didn't personally deal with that. It's something that I do need to research more so I can, help people that do see that. But what have been recommendations that you give? And can you explain that a little bit for people that don't know what that is?
Yeah, so diastasis recti is basically looking at, that line down the center of your abdominal wall where your abs join in the middle. That is an area that gets under load when we carry a baby in our belly, and you can actually get an abdominal separation going on. With pregnancy, what that looks like, if you go to do a crunch to get out of a lying down position, you'll see your abdominal wall kind of tent. That's an indication that you have that separation in your tummy. And there's a lot of recent research out saying that 100% of women at 37 weeks pregnant will have some degree of this diastasis. And what it means for us is that it will change the integrity of our core. So it changes how our core functions and how it can carry load. So this is something that you could really integrate into your rehab postpartum to make sure that your abdominal wall is actually holding tension like it's supposed to. Jesse Mundel's program, that Core Floor Restore, focuses a lot on that diastasis. You can have this assessed by pelvic floor physio. I assess mamas postpartum for the diastasis in the office. Mm-hmm. It's an easy thing to learn how to do at home too, just to see if you have any separation. That's one of the videos that'll be in the program too. A really good resource for diastasis would be Diane Lee. She just put out a clinical guide for women that have diastasis, and she is just a wealth of knowledge when it comes to diastasis.
Awesome.
Yeah.
No, I'll check that out too. And have you noticed, because I know that you have a lot of people that, probably have that come in to see you.
Yeah.
Do you notice a big, different subluxation patterns in their low back when they have that? Are you seeing a lot more low back and hip issues when somebody has that because they're not having the abdominal strength that they should? Yeah,
totally. So when you look back at that core canister, if you have dysfunction in the front, it's totally going to affect the load that's on those spinal joints. So low back, joint dysfunction, and the pelvic joints, it really will affect how those feel if you don't have that integrity in the front wall.
Yeah, I was just wondering because if somebody's having abnormal for them low back pain, hip pain post pregnancy, they might have that and not even realize it if it's just minor.
So true, and that too in the pelvic floor, right? If you have dysfunction there, that's totally going to affect how your spinal joints will feel as well.
Yeah, absolutely. Yeah. And like you were saying, just the most important thing is just obviously get checked by a chiropractor. If you can do it before pregnancy, during, after, it's always the best way to go. But definitely, after to check and see to make sure everything's good, as well as a physio that deals with pelvic floor issues.
Absolutely.
Yeah, and what is the best way for people to follow you on social media? That way they can keep up with your programs and what you're doing. I know you mentioned your website, but if you want to mention that again, and then we'll put it all in the show notes for people.
Cool. So my website is gilliansawyer.com. I also am on social media. So on Instagram, it's just at Dr. Gillian Sawyer, and same with Facebook. And my name, Gillian, is spelled with a G.
Awesome. Perfect. Mm-hmm. Yeah, I'll put all of those in the show notes. And yeah, guys, definitely go check her on Instagram. She puts out so many helpful videos. And definitely sign up for the program because you're going to get all of that information plus more. And I know that you guys will learn so much from listening and reading her information. So thank you so much, Dr. Gillian, for coming on. I really appreciate it.
Oh, I appreciate it so much. Thank you so much for having me.